Yeah.
Median PFS on the experimental arm was something like 40.7 months.
13-month difference.
That's extraordinary. Can you tell me about that trial? Maybe it's the trial design to start with?
Sure. So Destiny-Breast09 randomized patients to a taxane with dual anti-HER2 antibody therapy, Trastuzumab, pertuzumab, a la the Cleopatra regimen.
Based.
And I think a minimum of 6 cycles, important to say, because, some of us over the years have perhaps been stopping at 4 when appropriate. And compare that to Trastuzumab Deruxtecan with pertuzumab versus Trastuzumab Deruxtecan with placebo. Ultimately, unlike the Cleopatra regimen, endocrine therapy was allowed when the taxane after a minimum of 6 cycles was dropped, or after 6 cycles of TDXD.
Right. And then there was a TDXD placebo arm without the pertuzumab. I understand there were insufficient events for that arm to be yet recorded.
We don't have the data regarding that.
And interim. So we'll wait until we get enough events to see that. I'm sure probably this year, the coming year, probably 2026, we'll see that. What were the general kind of patient characteristics in Destiny-Breast09?
I mean, these were pretty classic first-line metastatic patients. I think they had to be more than 6 months from curative intent treatment.
Right.
Otherwise, I think very representative of our real-world HER2-positive population.
Yeah, I mean, there was a slight numerical, a little more than half were steroid receptor positive.
True.
I expected in this kind of population. And then they were, chemo naive in the metastatic setting.
About a third PIK mutated, right?
About a 30% PI3 kinase mutation. And Asian predominant patient population. I think about maybe over 40% Asian population here.
Few Black women.
Unfortunately, that's the case. And then let's see if there's any other patient characteristics that I thought were important. I think that covers most of the bases. We did steroid receptor. Yeah, that's a pretty good review.
Central nervous system.
I think stable brain mets were allowed, but it was a small fraction. Maybe
Asymptomatic is stable.
Yeah,
Yep.
I think it was only about 6% and brain mets at baseline. And then in terms of the treatment, what were the top line data for the primary endpoint?
I mean, the primary endpoint was favored TDXD and pertuzumab in the comparison to taxane, pertuzumab, trastuzumab. Regarding the TDXD placebo arm, we don't know the results of yet. A prolongation in progression-free survival. And the progression-free survival in the taxane arm was much longer than that, which we saw in the Cleopatra arm, which is something to be noted. But also a substantial improvement in response rate, some increased toxicity, and the pneumonitis trial.
I'll talk about that in just a minute. I want to spend more time on that, actually.
Yeah.
So I think the hazard ratio was 0.5 and change with 4 zeros after the decimal and the p-value. Pretty impressive, robust efficacy signal. Median PFS on the experimental arm was something like 40.7 months.
13-month difference.
That's extraordinary.
Yeah.
Over a 13-month difference at the median.
Agree.
That's pretty extraordinary. We haven't seen anything like that in first-line metastatic disease, especially against such a robust regimen as the Cleopatra regimen.
Yeah.
So what are your thoughts on that? Is this going to be routine for every patient now in the first-line metastatic setting?
It's a complicated discussion, but the answer is yes, this is a very effective drug. I'm very enthusiastic about this.